This is the Food and Justice Podcast with Brenda Sanders.
Hello, everyone, and thank you so much for tuning in to Food and Justice with Brenda Sanders. I have an amazing guest today. I'm very, very excited to have her on the show. Enza Rocco, JD, MSW, Masters of Bioethics, is an experienced professor in higher education, specializing in ethics, food justice, end-of-life care, social responsibility of medicine, equity and access in healthcare, and public health. She is a nationally recognized healthcare ethics consultant and invited speaker. She is a skilled advocate in food justice and legal and ethical issues in end-of-life care. Enza works to make healthy food accessible to all people and advance policy changes that promote equity and dignity. And that is so much amazing stuff. And I'm so happy, Enza, to have you on the show. Thank you so much for being here.
I'm so excited to be here. I love your podcast. And when I found it, it was just such an incredible moment. And I just enjoyed listening to it. And I think you really delve into such vital issues, and your guests have been awesome. So this is, I'm definitely fangirling here today because I admire the work that you do so much. And I think that you're really paving the way into really talking about the issues that matter in food justice, and the people who you attract on your show are also doing similar things. So I look to you as a mentor in what I do. So I'm excited to be here.
Oh my gosh. Okay. Wow. That was quite a boost to the old ego. Thank you for that. I appreciate you and I appreciate your work. And I'm like fangirling over here on you. So the feeling is mutual. And so we have a lot to talk about, some really important stuff. I'm so glad that our audience is going to be able to hear the things that you have to say, because I've already heard some of the things you have to say, and it's all very, very important. So I will start off by asking you to tell us about the Farm to Families program.
Sure. Farm to Families is a partnership between the St. Christopher's Hospital Foundation and Temple University School of Medicine Center for Urban Bioethics in Philadelphia. It's a partnership that started in 2016 to bring in healthy fruits and vegetables to our area. So we're in North Philadelphia. We're in an area that doesn't have a whole ton of healthy food options. So where we are near the medical school, we actually don't have a grocery store within walking distance. And so we believe that two of the biggest barriers to getting healthy foods are cost and access. And so we wanted to address that. I took over the program about 2 weeks before COVID hit, but it existed, prior to that. And so we're a bioethics center, and, we believe in food choice. We don't believe in prescriptive diets, and, we believe in food autonomy. And, we want people to be able to choose what they want to eat. And so, Farm to Families is a program that encourages that. We bring in a ton of different fruits and vegetables every week, and people are able to get them at low cost or no cost.
Wow. I mean, that's amazing. I would love to see a program like this in every city, everywhere, because the issues that you're experiencing in Philadelphia, we're experiencing in Baltimore, and I'm sure folks are experiencing in every major city across the country. So thank you for doing that work. It's so necessary.
It's definitely replicable. I think COVID hit us very, very hard in Philadelphia, North Philadelphia. And, some of our members said that Farm to Families was the source of groceries, or the source of fresh foods during the height of the pandemic. And so, we had to restructure, as many food organizations did, during COVID, to make sure that we were actually meeting community needs. We switched from a pickup model. We were having folks pick up in the hospital, which not a good idea,
No.
To a delivery model, which I think was much more effective, to have that accessibility. A lot of our members, weren't able to stand in line at the distribution sites, weren't safe to do that. And, the policymakers, I think, were very well-meaning in setting up the distribution sites, but it assumed that people could actually get out of the house, that they could stand, that there was even food at the end of it. Some of our folks would actually go, and at the end there wasn't any food. And so the delivery really was much more effective for our folks. And so I think that model will stay, and it's been a good switch for us.
Amazing. Amazing. So in terms of these programs that are connecting farms with urban environments, why do you think that it's important to connect farms with urban communities?
I think urban communities often lack grocery stores, and even when they do, we did a study with our members, and we found out that the grocery stores can lack fresh produce. Sometimes they're not stocked well, and even when they are, it can be expensive. You can see that they're kind of on their way out. They're wilting. They're kind of brown. And nobody wants to pay an expensive price for a tomato that's already kind of mushy. The salad bags you can already see are not going to last the week. And so farms give fresh organic options. And I think once you see what a healthy tomato is supposed to look like, or lettuce that's fresh green from the farm, you're not going to go back. And so it also exposes people to fruits and vegetables that they might not otherwise try. Some of our members talked about, with these limited options, people would resort to frozen or canned vegetables because that was the best choice. You're not going to buy stuff that isn't going to last. And so, being able to try new things, really gave people just a chance to experiment with food. We have a ton of corner stores, so it's not actually a lack of food in North Philadelphia, but it's a lack of healthy food. And so nutritional scarcity really is a big problem that we have. And so we do have local farms, we have urban gardens, and those are wonderful. And I think, when you partner with other bigger farms too, you get just more variety, but certainly the local ones provide the lettuces and the corn and the tomatoes that are all awesome too. And a lot of our members join too because they want to experience health benefits. Maybe they've learned that they might be pre-diabetic, or they've seen a family member experience high cholesterol or have a heart attack or things like that, and they're trying to add in some more fruits and vegetables, and so it just makes it a lot easier. So we want to support farms. We especially want to support the Black farmers. So any chance that you can in your own communities to support Black farmers, please do it. But ultimately, it's up to the communities to direct what they want, to buy what they want. And so, being able to have that choice, have that autonomy, I think is so important. And a lot of places that, are devoid of grocery stores, people don't really have choice to get what they want to get.
It's absolutely true. It's certainly true here in Baltimore. And I mean, COVID has just changed the entire game. Everything that you said, from, the supply chain, the food supply chain being like completely thrown off. And so you don't even really get access to fresh food anymore, fresh fruits and vegetables anymore. Everything is wilted and kind of old and isn't even going to last a week. And so we certainly have seen a lot of those same things. And of course, not having access to healthy fresh foods leads to health disparities. I mean, it just only makes sense. And so I wanted to ask you, why would you say that health disparities are a bioethics issue?
I think that health disparities reflect, historical injustices that have happened, many of which have happened in medicine. And so we've had a history of experimenting on Black and brown bodies in gynecology and other areas of medicine. We've had terrible research violations. Of course, everybody knows about Henrietta Lacks, about Tuskegee. And we've created medical mistrust among communities that have very real reason not to trust health systems. I think we also tend to think of those as being in the distant past, and they're not. The Baltimore lead study was in the 90s. And so we must always be very vigilant about, not having these research violations happen, because they can happen. We saw major health disparities during COVID. Health disparities are constantly happening. Racism itself is a chronic condition. There's an article that came out just a month ago, anti-Black racism as a chronic condition. Dr. Nika Setterstrom and a colleague wrote that, and it's a must read for anybody, who is interested in this, because racism has had so many awful effects on health for years and years and years. And so when people think of bioethics, they often think of, really big issues like abortion. And of course, that is a very big issue right now, and a major one that we must be thinking of. But, other issues like death with dignity and CRISPR and sort of like those things. But I think access to food, these sorts of advocacy issues confronting the fact that, bioethics itself was born out of medical errors and research violations, is something that we must confront. And we're seeing a move towards, advocacy and sort of addressing this now. And it's time. I mean, it's really time that we do this. But bioethics really should encompass, all of this. Health disparities are absolutely unethical because they're coming from a place of systemic racism. I mean, it's playing out, exactly as the system intended. I mean, it's no mystery, why these things are happening. And so we really must confront them. And I think COVID has shined a very big light on things like food insecurity and access to care.
Yes. And thank you so much for saying that it's playing out exactly as it was intended, because so many people are not acknowledging the fact that this is not a mistake. This didn't just happen. This is a well thought out plan, and it has worked. So, a lot of folks who are living through this, including myself, growing up, in the projects in Baltimore City, I literally thought it was normal to not have fresh food. I didn't have fresh food, fresh fruit, fresh vegetables growing up. I just didn't. And that was just, like we didn't have a grocery store. So it was just normal. It's a normal part of life. And so like getting out of the hood and getting out into other areas and finding out that there was this whole other world out there was quite the culture shock. So we need to bring these things into these communities so that other people don't have to go through what so many of us have had to go through. So thank you for that. So you're talking about systemic racism here, and I'm so thankful that you're doing that, because like I don't want to always be the one talking about systemic racism. It's like, oh, here we go again, talking about, racism. But in your work, I feel like you've seen a lot of how systemic racism actually drives food security. Can you talk a little bit about that?
Yeah, I mean, hunger isn't caused by lack of food. It's a product of social and political design. We have enough food. We actually have more food than we need. Over 40% of our food goes to waste. So it isn't a matter of getting more food. And a lot of times we hear the word food desert. North Philadelphia is a food desert, or Baltimore is a food desert. And that's not, it's not a correct term. And the activist Dara Cooper points out it's food apartheid. It is the systematic destruction of Black and brown communities from having food choice. And it's a hypersaturation of corner stores, of unhealthy foods. And it's corporate controlled food systems that lead to these chronic health conditions. It's a total destruction of food autonomy. And food desert in no way captures what's going on in neighborhoods like North Philadelphia. And you look at the old redlining maps and you can see that nothing has changed. I mean, you lay them on top of places like North Philadelphia and you can see that nothing has changed. Yep. It could change, if we wanted it to change, it could absolutely change, and it hasn't. And so people should have genuine choice around food. People should have choice, but that requires economic agency. And so, you think about, why are we getting to the point where we have these major food emergencies? And, when I was doing, not just farm to families, but really boots on the ground work during COVID, people are listing to me what they have in the refrigerator or their freezer. And it's like one or two things. You know, I had a man who literally stopped eating because he had a terrible seizure condition, and he had service dogs, and he had to feed his dogs because he knew if something happened to him, he needed his dogs.
Wow.
And he couldn't afford to feed himself and his dogs. Why are we getting to that situation? I had several moms who were unable to afford formula, and they were feeding their, you know, weeks old babies juice and water. My oldest client was 98. You know, I had weeks old babies. I had a Vietnamese couple who, at the time I was in contact with them, had been eating rice for 3 weeks straight. So, you know, we should never, you know, with the abundance of food that we have, be getting into situations where people, you know, are getting to the point that they don't have any food at all, or they're not eating, or they're rationing their food in this way. But when we look at food in this sort of siloed way, that we have food insecurity, and that's, you know, over here, and we don't consider all these other things that lead to it, like housing insecurity, like, you know, inadequate health insurance or costly health insurance, or the cost of medical care, or the fact that we need to raise the minimum wage, or, you know, racism, or, you know, the fact that we've had these little breadcrumbs during COVID where, you know, maybe you wouldn't get evicted, or maybe you get these little boosts, but then they get taken away. You know, with period poverty, we have all these things that contribute to food insecurity. You know, if you're a formerly incarcerated individual, you have a very hard time when you come out getting a job, getting housing. And that also leads to not getting food. We have so much focus on recidivism. That's the way we measure success. We don't measure it based on, like, is this person, when they get out, able to thrive? And so, like, all of that is connected. To be able to really elevate communities, we can't just address food, we have to address, like, all of these other things, so that people have the economic agency, the actual capability to access the food that they want to access. And people are just left, you know, swimming in place year after year after year. The first food bank was started in 1967. Like, we've given out billions of food to millions of people, and this isn't working. You know, SNAP, all of these programs, it's not working. Something else has to happen so that people can get lifted up way more than they are to get out of it.
Food injustice is made possible with support from Defund Big Meat, a grassroots effort to encourage strategic collaboration across all sectors of global justice. Find more information about Defund Big Meat at defundbigmeat.org. A Well-Fed World, an international hunger relief and food justice organization advancing plant-based foods and farming to create a nourished and climate-friendly future. Find out more about A Well-Fed World at awfw.org. Better Food Foundation, an organization that promotes dietary changes to build a healthy, equitable, humane, and environmentally sustainable food system. You can find out more about Better Food Foundation at betterfoodfoundation.org. And Farm Sanctuary, a farmed animal sanctuary working to fight the disastrous effects of animal agriculture on animals, the environment, social justice, and public health through rescue, education, and advocacy. Find out more about Farm Sanctuary at farmsanctuary.org.
You're connecting the issues. And why aren't more people connecting the issues? I don't know. It's almost like even within the advocacy communities, a lot of us just sort of work in our own, you know, spin in our own little solar systems, and aren't necessarily connecting those issues even with each other, you know. And I just think it's so important for us to, I mean, housing insecurity can lead to food insecurity. My goodness, it's so obvious. It's so obvious, but we're not really talking about it. And we have to be. We have to start talking about these things. My goodness. I mean, this.
Like, what's the thing that goes when you have a limited income? You know, you have to keep the lights on, you have to keep the house, and that becomes like the flex budget. And so, you know, you have moms, I've seen moms stop eating or eat less because that's the money they have to play with, right? And I use that, if you can't see me, I'm saying in quotes, play with, because that's the money that they don't have to pay, you know, to keep their house or to keep their lights on. And so then that's the money that, you know, they don't use to feed themselves. And that's horrendous, because food is a right, food is essential. You know, you can't focus in school, you know, kids can't focus if they don't have full bellies. I mean, that is a trauma in itself, not to have food, not to know that you're going to have food. So,
I could tell stories.
Absolutely related.
I mean, to this day, I sometimes hoard food. I can't, like, it's just a part of who I am. You know, sometimes I'll just like hide food, you know, because there were so many times with growing up when there wasn't any, there was no food, you know, and that sticks with you. That trauma sticks with you. So you are absolutely right. I mean, it's heartbreaking to hear these stories. And I know that you're not the only person doing this work that has these stories. There are just probably so many. I've heard stories. It's heartbreaking. And so now we're going to continue with the heartbreak, because I want to ask you about charity, because everybody is like, you know, kind of elevates charity up, you know, to the highest levels of, you know, of goodness and light. And, you know, and that's not to say that charity is a bad thing. I mean, it's necessary, but you said in a conversation that you and I had that charity is not true justice. And I thought that was such an intriguing idea. And so I was wondering if you could go in more into that.
Yeah, you know, like I said, the first food bank started in 1967. So, you know, we can see that alone doesn't, you know, solve hunger. And, you know, like I said, we grow up thinking that, you know, you collect canned goods, you collect your pennies, you collect your money as a kid, you know, attacking this big giant thing called hunger that naturally exists and that will never solve. And hunger isn't natural, and hunger can be solved. And so we're already kind of like growing up in this mindset, at least I did, you know, when I was little, we were collecting canned goods and things to solve this big thing, but that's the wrong way to look at it. And not to say that charity isn't essential, because in the system that we're in now, people need food today. And but it doesn't fix tomorrow or this sort of longitudinal vision. And we always have to ask ourselves, you know, are we addressing, you know, hunger today, or are we looking at feeding people tomorrow and the next day? And we can do both, like absolutely food pantries and food banks, and anybody, you know, in this work can do both. But those are two very different questions. And so you can do great harm if you're only feeding people today, and it's necessary. But if you're not looking at the bigger picture, then we're just going to continue this cycle. And it's hard when nobody wants to turn a critical eye to charity, because it's hard to do that and it's uncomfortable. But, you know, we need to do that for many reasons, you know, to make sure that we're actually providing good services and accurate services and services that community members want. But also, you know, to make sure that another reason is that we're not letting the government off the hook, right? So SNAP and other programs like it don't really need to change if charity is always filling that gap. So we don't need to increase our SNAP dollars if we have charity there too. But again, we're never lifting people up enough to get out of it. And so charity has become, you know, this term big hunger, you know, is a very real thing. You know, we have all these institutions now and nonprofits that are devoted to fighting hunger, but hunger isn't being solved. Right. And we really have to sit with that and ask ourselves why. And that is, you know, when I started really thinking about that is extremely uncomfortable. And when we have charity, it also promotes this kind of hierarchy of the giver and the receiver, which also is not so good, because then you have this idea of gratitude. And now I hate hearing thank you from people. I hate hearing thank you from our members, and our members are amazing, and, you know, they do say thank you, but you have to get past the thank yous. because food is a right. Healthy food is a right.
Mm.
You never want to be in a situation where people are thanking other people for giving them what I think is a right. And so having this elevated giver and receiver, terrible, especially when you're talking about things like things that should be a right and accessible to all people. So only, having charity and not looking at this bigger picture, just perpetuates the problem that we're in. Yes, we need to feed people today. Absolutely. We can't just, erase charity and erase food pantries and food programs because they are necessary. But we have to be working at, changing things on a policy level, working to empower people and working to empower communities to figure out, what we can do. And that really differs by people, by zip code. But dismantling this charity system and replacing it with, a different structure where, we're raising the minimum wage, we're changing healthcare, we're bettering housing. We have to ask ourselves, who is at the table making these decisions? Because, are the voices of people who've actually experienced hunger making decisions or participating in the discussion at all? Because a lot of times, even in really well-meaning organizations, the voices of people who have experienced hunger or food insecurity are not represented.
Sure.
And so you have to have that voice there. And I think there's real room for activism. There's real room for change in organizations that, are set up for this, food banks, food pantries, people involved in this kind of work. If they want to take on this challenge, they absolutely are well positioned to do it. But it requires, a commitment to stop expanding social services and rather putting that attention towards empowering people, in these areas that are so connected, like housing and healthcare and all of that. There's a book, Street Level Bureaucracy, that came out like decades ago. And it talks about how we never really get at solving problems, but we continue to expand social services rather than really attacking the problem. And it could be written today. I mean, that's what we're doing. We continue to create more programs rather than, get at the heart of the issue. So, we often evaluate, there's in one of the books, I think it was Sweet Charity or Toxic Charity, both are really good books. We talk about how we evaluate programs like this is how we feel afterwards. Do we feel like we made a difference? You have an MLK Day of Service and you cleaned up a whole neighborhood. You're like, you know what? I feel really good about myself. But guess what? The next day, the neighborhood is going to be messy and might have needles again and all this other stuff. So you have to stop evaluating the effectiveness of a program based on how you feel, but actually, what is happening.
This is really interesting. You jogged two memories for me. I don't have a lot of memories from my childhood, but you just listening to you talking about charity, just kind of dredged two of them up. One of them is when you were talking about the canned good collection and donation, because I was one of the families that would get the canned goods that were collected by kids in schools, and I was a kid, and I remember thinking, wow, that is so weird that there are kids who have so much food that they can give some away. I distinctly remember thinking that back when I was a kid. And the other memory was that there would, every once in a while, there would be groups of white people who would come into our neighborhoods to do cleanups. And they would never really interact with us, and they would all have on matching t-shirts for whatever church or whatever organization they were working for, but they were on a mission, and they were there to clean up, and once they were done cleaning up, they were gone, and we would probably never see them again, honestly, until the next group of well-meaning white people came into the community to do a cleanup, or a clothing giveaway, or a canned good giveaway, or something like that. So I very much have have lived through being on the receiving side of this charity of which you speak. So it's interesting situation. I wanna check out these two books that you talked about as well. One was Toxic Charity, and the other one was
Sweet Charity.
Sweet Charity.
There's also another book called Reinventing Food Banks and Food Pantries by Katie Martin. It's also a really great book about sort of thinking longitudinally about hunger.
Okay. Well, thank you for those recommendations. We always appreciate that. So another thing that we talked about that I found to be really heartbreaking, and just so people know, it's not all sad. Like there is hope, and there is the possibility for change. So I don't want people to get too bogged down, although I do want people to be informed. I think that's very important. But you talked about how there are reasons why some people, for instance, undocumented workers, are afraid to apply for public services, even when they're in need and they would qualify for those services. Can you elaborate on why that is?
Yeah, I think a lot of attention is given to confronting stigma in food pantries. How can we make sure that once people are in, they feel welcome and they don't have stigma? And that's assuming that people even get in the door. There's a lot of things that prevent people from even accessing the service. And one is fear. And that fear especially hits undocumented folks. And I saw that firsthand during the pandemic, where I had a mom who very much needed a whole lot of stuff herself and her baby. She was giving the baby juice and water and regular milk because she was afraid to go to WIC to get, and she was eligible, to get services because she was afraid that she would get deported. And, WIC was not going to turn her in. But that was a very real fear. And I think, the last administration relied heavily on fear, and we've seen a big decrease in numbers in WIC, and we saw a big decrease in numbers during that administration. And undocumented workers are twice as likely to experience food insecurity and nutritional scarcity as other folks, and so they're especially hit hard. And that fear is terrible because it's preventing, access of services. Now, government programs like WIC are not, they're not going to deport moms. But I think that, administrations, when you start to get messaging of intolerance and fear, from the top down like that, I mean, those fears are very real. And so it happened, I saw it happen more than once. I think in general, there were some articles written about it in Philadelphia, that decrease in numbers in WIC, and, it's terrible. And there's a lot of reasons why people don't access services. Fear, I think, is one of them. Of course, embarrassment of being seen. I had one client who got $7 from SNAP, and she absolutely needed help. But when she got the $7, she was like, well, I guess that means that other people need it more. And that's sort of the government's way of telling me. And I'm like, God, no, this is just so messed up. And so she continues to struggle because she felt like, well, I'm not going to apply again, because if they're just giving me $7, then, other people definitely need it more. And so there's just a lot of things that happen that then become the reason why somebody doesn't seek services. And we need to look more into that. And of course, we don't know what they are. I mean, we're just guessing. And that's really where talking to, that's where the voices of people who've experienced hunger and talking to community members really, really matters, because I never would have known that would be the reason why somebody wouldn't apply is getting that $7. Yeah. Of course, $7 matters, and $7 can really be the difference, for somebody, but $7 is never going to cover somebody's groceries for a month. And so we really have to evaluate, what people are getting, and that person absolutely needed more money, but now she's not accessing it. So
it really is heartbreaking. I mean, these stories, they really just kind of motivate me to want to figure out, like, what can I do? I mean, it's what I came from, and certainly things that I experienced, and now that I am in a different place, I just felt like it is my responsibility to come back and to do something. And I don't know, that's just like kind of how I'm set up. But I mean, it's so hard to hear these stories because, like you were saying, there's so much abundance. I mean, even here in Baltimore, there are areas of Baltimore where you can go and it's just nothing but millionaires, and you know it. I mean, there's like down by the waterfront, there's all these yachts and people just sitting out on the balconies of their condos and this kind of thing, and you can feel, you can smell the wealth, you can smell it. And then you go into like the neighborhoods where I work, and the poverty, I mean, there are just people on every single corner asking for money for food, and, you know, coming up and saying that they need help. And just like everybody needs help, and everybody is in need, and it's in the same city, you know? And it's just like, it's surreal. It really is. And I know that there are solutions, and I know that those solutions could have been implemented decades ago. And so that just brings me back to this idea that this is by design. It has to be. There's no way that this could not be by design.
I think one of the most alarming things about these urban areas is that the disparities happen in very close proximity to each other. Mm-hmm. So really, you know, we have the Liberty Bell, and then we have this area called Strawberry Mansion, and depending on where you live, you're going to live 20 years longer or 20 years fewer, and that's a 4-mile walk. So wow. The difference of 4 miles impacts your life expectancy by 20 years or more. I mean, that's just unbelievable to me. So your zip code, I mean, you know, public health researchers say this all the time, but your zip code really does matter more than your genetic makeup. And that is awful.
Yeah. We literally could be in the same city.
It's very similar. It's very similar.
Same thing. Wow. And one of the things I've noticed is that here in Baltimore, and probably in Philly as well, is that these medical centers will pop up in these marginalized communities, and I do think that they try to assist community members with these different issues that they're dealing with. But you had mentioned that you had experiences where you saw that there were deeper issues that may not have been getting asked or may not have been considered. And I found that fascinating as well. Can you tell us what some of those circumstances may be that aren't being taken into consideration when these folks are coming in to assist with these marginalized individuals?
Yeah, absolutely. So in general, healthcare professionals are not taught how to talk to people about food insecurity, about food prep, about, you know, those sorts of, the conversation often stops at, you have X problem, you know, high blood sugar, you have, you know, high blood pressure, you need to eat healthier. And you never really hear somebody go into it. First of all, doctor's appointments are very quick, you know, so you never really then are asked, you know, do you have the ability to access healthier foods? It's just eat healthier. Mm-hmm. And so you're never asked, you know, do you have a kitchen? Do you have a refrigerator? Do you have a stove? Do you have, you know, arthritis in your hands so that it, you know, like, so it's hard to chop vegetables or cook vegetables. You know, Clancy Harrison in the Food Dignity Institute asked, you know, she asked the questions like, do you have teeth to chew? And they're doing a lot of work around trying to train health professionals to like think about these questions and to think about the words that they use, because those are all really important. You know, do you have access to stores? Obviously, but, you know, can you carry the food back? You know, like all of these things really matter. It's not just eat healthier.
The Food and Justice Podcast is proud to be organizational partners with Afro-Vegan Society, Food Empowerment Project, Grow Where You Are, and Vine Sanctuary.
And so you have to be able to ask questions in a really non-judgmental way about, you know, if they're able to actually access these things. And I also think it's the responsibility of health centers when they plant themselves in under-resourced communities, not just to, you know, to tell people to eat healthier, but to think about ways that they can support communities in accessing things like, you know, better grocery stores and really investing in communities. The other thing to think about is that health professionals can do very real harm when those conversations go wrong. And an example of that is one of our members was told that she was obese at age 9. Now, no child should ever be told that they're obese at 9. I mean, that is just absolutely wrong. And that label continued to be given to her over her childhood through high school. Medical professionals continued to label her incorrectly, and that caused so much trauma. Now she's 70, she's fit, she's active, she's healthy, she had bariatric surgery. And let me tell you, she has so much trauma around being misunderstood, never being heard, and being misdiagnosed by doctors, white male doctors, her whole life. And she's so bright, and she's so vibrant, and she's so haunted by this. And you can't take that back. I mean, those conversations that they probably don't remember at all, that were minutes long, had such a profound impact on her.
Yeah.
So, I mean, the medical profession has a duty to do no harm, and that did major harm. So looking at language, even from well-meaning professionals, you know, not going so far as calling someone obese, which is never okay, but really thinking about your own bias. And, you know, I've heard medical professionals say things that, you know, are just not okay. So really thinking about how you talk to people. No, not everybody's unhealthy because they're eating at corner stores or McDonald's or whatever. That's just not the case. People want to be healthy. People want to eat healthy foods. People are eating healthy foods. They're not eating at corner stores for the most part. You know, when we did our research study, none of our members are eating at the corner stores. They're traveling farther, and they're paying more money to get healthy fruits and vegetables. So one, health providers need to like check their own bias first. And two, really need to seek out training and sort of be open enough to sort of acknowledge like that training it might not be, you know, just known. Like you need to sort of practice on how to talk to people, especially if you yourself have an experience with insecurity, about how to have those conversations. I also think that's where social workers can really be helpful. That's where nutritionists, you know, dietitians can really help assist with that. But, you know, we need to work with patients, not just for research, especially when you have these big academic centers to come in. Don't always do research. Don't always do it just to publish articles, but really, you know, if you're committed to bettering the community, better the community. And any initiative has to be directed by the community. So like checking in, you know, if you're starting something, it has to always be directed by the community. And you have to be open to the fact that the community might not actually want it. So you might have a great idea for something, and you might have a ton of money for it. And you have to be open to the idea that the community might say, you know what, we don't want it, or we don't want it from you. That's okay, right? No, that's all right. But, you know, health professionals can do a great amount of good. They can do a great amount of harm in minutes. And so, you know, being able to really think about language and how we go about talking to people, and then giving them resources. So if somebody says, you know, actually, I don't have the ability to go to a store, or I don't have a refrigerator at home, you know, being able to partner with agencies to then direct them to get help with that, I think is essential. You know, and so when we interviewed our participants, and I say research study, but really my goal in this was program evaluation. You know, we were saying, yes, we're helping food insecurity. Yeah, you know, I was like, are we? Maybe we're creating food waste. We don't actually know because we haven't asked. We haven't even, we're still coding ourselves. We don't even know. My main goal in this really was to figure out, like, is this program even helping? I don't know. I think we are. I mean, I truly thought we were. But I didn't feel comfortable doing it unless I really talked to people. So we did these qualitative interviews where we talked to people for a very long time, and we did photo voice. We gave them cameras to take pictures of the things that we were doing.
Mm.
So in that, I learned so much about not just our program, but like trauma around food and the impact of, family and COVID and just a lot of stuff. And so that was all very important, but people would tell us, they're traveling 45 minutes or more, to get food. And I didn't know that, I didn't know exactly how far people were going to get food and how long it was taking them.
Yeah, it's ridiculous. And the way cities are set up too, it's just like that's also by design. I mean, it's like the layout of cities it just creates that kind of situation.
And if you're a healthcare practitioner and you've never taken public transportation with 2 kids or 3, I have 3 kids, right? And I hate even going to Target with them because it is chaos. It is chaos. So getting on a bus and going grocery shopping and carrying all those bags back and then adding in, rain or snow or, whatever. It is so hard to do that. But families do that all the time. And subway stations and bus stations are not close to grocery stores and then not close to the house. And especially during the pandemic, it is hard to do.
You talk about the programs that you've taken part in, and I was wondering, because I know what I've seen from education programs and how bringing education programs into communities makes a huge difference when trying to promote healthier eating. What have you seen in terms of education programs and the role that they play in promoting healthier eating?
I think they can be really effective as long as they're community driven. So you're really asking people like what they want, because if you're a nonprofit or a health system and you decide you're going to do a cooking demo, but there isn't that community buy-in, maybe 3 people show up.
Yes.
And then you're like, oh no, nobody showed up. I can't, why was that? But if you're actually asking people and you're partnering with churches or other organizations and you're asking people exactly what they want, then that's much more effective. And we found that now that people are sort of experimenting with food and they're making their own recipes, and we have one member who's like writing her own recipe book, that members actually want to share with each other about healthy eating. We had one member who had never had anything other than canned goods. And that's the member who's writing the recipe book. And it's so cool. And so they want to exchange ideas with each other. And that sort of peer support, I think, is awesome. And I think that like the most effective thing actually is that kind of peer support. Nutritionists, dietitians, community health workers, I think all of that also is really impactful. I think that's sort of it. Like these sort of recipe exchanges from peers, we've really seen that. We also have had requests for like the dietitians and the nutritionists, because people have questions like, well, I've recently been diagnosed with diabetes, like what can I eat? And so they'll ask me and I'm like, well, I don't totally know. So then you bring in people who can answer like all those little questions. And that's really helpful, because then people, once they get a diagnosis or whatever, and we've had people totally get off their diabetes medication. And that's been amazing, but they have a lot of questions like that. But, I think any sort of intervention always has to be coupled with education, or you offer education. We just had this big, the FDA is banning menthol in cigarettes. And I have mixed feelings about this, because it's like this there's a whole history behind that, right? So the ban isn't magically going to make people stop smoking. And I wonder, it might actually cause harm, right? So what other supports are there going to be? And I think the communities really need to think about what support we're going to put out there. And I think that's a place where education about smoking cessation, community health workers are vital, because you really have to look at, street by street, zip code by zip code, about what people need and meet the needs there. And I think, whether it's smoking or whether it's food or whatever, making sure that, you're asking people like, how can I help? And then doing that, or else you're just giving your own opinion about it, and that doesn't really matter.
Indeed. And I certainly can attest to that. And I can also attest to having to bring in medical professionals, dietitians, nutritionists. I started out just doing my little workshops and just telling people what I knew, the things that had helped me in my life. But eventually it got to a point where people were asking me very specific things like, I have high blood pressure or I have heart disease. And I was like, ooh, yeah, I'm not, I'm not really qualified. So then, I started bringing in medical professionals to answer these questions. And then the workshops and classes exploded because it was just like, this is a place where we can go and like get real answers and real support and resources. So yeah, I'm so happy to be able to be engaged in this work. And I really hope that with the expansion of awareness of these issues, that more of the kinds of programming and things like that will start to pop up in other places too. Because like you said, it's very reproducible. It really is. So the pandemic, if you don't mind us circling back around to that, because we kind of started out talking about the pandemic. I know that I've learned a lot of things about the food system since in the past 2 years since the pandemic started. Oh my gosh, just about what causes pandemics, like the conditions that that they develop in and all these things, and relating those things to our food system. What do you think that could have been learned from the pandemic that maybe have not been? Because I'm there are some things that like we should have gotten from it, and it feels to me like we still haven't gotten it. So can you talk a little bit about that?
Yeah, during the time that food was hard to get, food prices were going up. For folks who eat meat was hard to get. During that time, we were actually mass slaughtering hundreds of animals in factory farms, and we were seeing the impact of COVID on factory farm workers. And I don't, anytime I tell people that we were sort of mass slaughtering factory farm animals during the pandemic, they seem surprised, or a lot of people don't know that. And that happened, and that was a result of the sort of inhumane way that we treat both factory farm animals and workers. And that just shine this gigantic bright light on how we really need to change our food system. With regard to factory farming, the fact that we're going to keep having these outbreaks of diseases, the way that we're running factory farms, it's really impossible to justify how we run factory farms and how we treat workers there. There's just like no adequate standard of living at all. And so I don't know that we've learned our lesson. I think we're seeing more trends towards thinking about, ethical eating, but in no way am I hearing, when it happened, it was like a big article in the New York Times, we're mass slaughtering all these animals, terrible the way we're treating factory workers, but I don't really hear about it anymore.
No.
And I think that lesson is one that, it's an uncomfortable one. It's very uncomfortable to sit with. It's uncomfortable to know that we as humans have created this. Again, not a natural thing, just didn't happen. We've created it. And we have to really think about the inconsistent way that we treat animals in this country, the way that we're running these systems. And so that is a lesson that I think we have to circle back to, or we're going to continue having problems. I think another thing that there's a lot of room for growth and thought among food justice folks is ethical food distribution. I talked about, the food sites that popped up in Philly and the well-meaning policymakers, but there was a lot of promotion of ableism and ageism, during this time. And I think there's really room to kind of make an ethical framework of what is ethical food distribution, especially during a crisis. So we're promoting accessibility. and we're not promoting these isms, racism, ableism, ageism, at a time when people really need stuff that's essential, like food. So, when you have barriers that are so big that, like people can't get out and get the stuff that they need, it's a real problem. So like making sure that, we're thinking about that framework is really important. I think also, really thinking about the qualifications that we have for food. I would have people call me and say that they need food, but then like a zip code would prevent them from getting, this senior center's food, or like they're 55, but they need to be 65, or they're 64 and they need to be 65. And it's like, oh my God, like I just need to, get them the food, like just get them the food. Yeah. And so these qualifications seem, I get it, you have to report to funders or whatever, but they seem at that time, in a crisis, we just have to get them food. And even the qualifications for SNAP, I don't even think we should have them. If someone is saying they need food, get them food. SNAP has like the least fraud of any program. And I don't think that people are lying when they say they need food. And so, having all these hoops that people need to jump through, or, filling out forms or identification, again, the fear, people have fear with that. But also, when somebody's 64 and not 65 and that prevents them from getting food from a place, it's terrible. So I just don't think we should have any qualifications. If somebody says they need food, we have to figure out ways to get food until we have this more longitudinal vision that I hope that we get to.
Yes. And that's where the hope comes in, because I do still feel hopeful. Good. Thank you. Because it is so easy to get bogged down in just how bad it is. But
I think there's a lot of good people in food work. I mean, you're in food work, and there's a lot of thoughtful people and people committed to it. I think COVID, has made more people think about it and talk about it. And so I think it's a good time to take advantage of funding and grant opportunities to, do the work that needs to be done. And so it's attracted very smart people and committed people, to the cause. So I am encouraged by that.
Yes, absolutely. And so now that people have heard all these things that they probably did not know, because there are several things that we talked about that I had no clue about, and I work in this, right? What can people do? First and foremost, how can people support the work that you're doing? Because it's very important. And then if you have any other ideas about things that people can do, I would love to hear them.
Yeah, I mean, if you're a health professional, have those meaningful conversations. Take the time to talk to people about not just eating healthier, but about food access, about, those next steps to make sure that they're able to access food. Stop looking at food in a silo, make those connections among all these other issues like housing and minimum wage and all these other things, and demand macro level changes. Elect policymakers who are gonna, look at this sort of holistic approach and, think about those macro level changes that need to happen. It's hard to confront that hunger didn't just happen naturally and, is man-made and is the result of systemic racism, and that's hard to sit with. Mm-hmm. But sit with it. Sit with it and think about how you can play a part in, the longitudinal change. And everybody can play a part in that, even if it's just voting. And so if you want to make a change, you can make a change. I think that looks different for everybody. But think about how, you want to do that. Think about what goes on your plate and what goes to waste. And whatever that means to you, you can also make a change there. And how can I support you? If you're a food bank or a food pantry and you want to talk more deeply about any of these issues, you can absolutely contact me.
That's so awesome. Thank you. Thank you so much. So I'll be contacting you. And I need help, Enza. I need help.
I would love to help.
Well, this has just been as amazing as I knew it would be. Wonderful discussion, important conversations to be had. And I am just so thankful that you've taken the time to be a part of this project and to be on the show. So thank you so much. We'll definitely.
My honor. I just think the world of you and the work that you're doing. So I'm so excited that I got to be here today.
Thank you so much. And thank you to the folks who have tuned in. There will be information on the website about ways that you can plug in, that you can just do something, because we know that folks are going to want to do something now. That's just the way it is. You find out, there was this saying, once you know better, you can do better, when I was growing up. And that's what this show is all about. So thank you everyone for tuning in, and we'll see you next week.
Thanks for tuning in to Food and Justice with Brenda Sanders. See you next time.